Hey everybody, welcome back to another episode of Breaking News with Bay. I wanted to talk to you about doing combined procedures, not mommy makeover combined procedures like a breast augmentation and a tummy tuck, but combined procedures amongst multiple specialties, specifically between an OBGYN and a plastic surgeon. Specifically a hysterectomy with a tummy tuck. Now, whenever I bring up doing a hysterectomy, which is the removal of a uterus because it's got fibroids or maybe spotting or something, whenever I bring up removing a uterus with a tummy tuck, people immediately say, well, what can you get a tummy tuck at the same time as a C-section or at the same time as you deliver a baby? So I want to start off the very beginning and make it clear, you definitely don't want to do a tummy tuck and a delivery at the same time, or a C-section and a tummy tuck at the same time, just because it's not really sterile. It's kind of a mess. Your body's going to tighten up on its own to some extent. So just get that out of your mind. Do not do a tummy tuck and a C-section or a delivery at the same time, okay? So now let's talk about doing a hysterectomy. So again, hysterectomy is when a woman has her uterus removed for multiple reasons, fibroids or causing pain, all that good stuff. And so you can take out the uterus and then do a tummy tuck at the same time. Now there's a couple nuances to this. First off, if they're just making a lower abdominal incision to take out the uterus, no problem. You use that same incision to do the tummy tuck, tighten up the abdominal wall, remove the excess skin, do liposuction, you can do all that. But things are getting a little fancier now, and doctors are doing this either laparoscopically or with the robot, which is just a more expensive laparoscopic way of doing things. So they'll just go through the belly button and a couple other small incisions in the abdomen to go through with a camera, see the uterus, release its blood supply, cut away from all the scar tissue around it or the adhesions around it, and they'll take out the uterus through the belly button. They have to cut it up into little pieces to get it out through that small incision. So I just wanted to say that even there's multiple different ways of doing it, after it's all said and done, after the uterus is taken out, then you can do the tummy tuck. Now, when the OBGYN is doing that, they're probably going to have to do that at a hospital because, I can't have a big old robot, Da Vinci robot, in my office-based operating room. The things cost like $1 million, so I'm not going to have one of those in my office. So we're going to have to do it. We had to do it at the hospital, for example. We did that yesterday, where we went to the hospital. The patient had our hysterectomy with the robot, and then I did the tummy tuck right after. So that complicates a lot of things when you have to do something like that at the hospital. It doesn't complicate it from the perspective of using the robot there. That's where you're supposed to use it, is at the hospital. But when you bring in a cosmetic case into a hospital, that's where things get a little complicated. So for example, the hysterectomy, that's covered by insurance, no problem. But then the tummy tuck, that's not covered by insurance, so the patient pays me, but instead of them paying my OR fees and my anesthesia fees as though they were doing it in my office, they have to pay the OR fees and the anesthesia fees at the hospital. And that's really complicated because they don't always know what those fees are. It's kind of hard for them to tell you that ahead of time. And so when they're doing the hysterectomy, insurance is covering that, but when they stop the hysterectomy and start the tummy tuck, then that's when the insurance payment stops and they start the clock, and depending on how long you're in the operating room doing the tummy tuck, then that patient's going to have to pay out of pocket after the fact. They have an estimate maybe, but they don't know exactly how much it's going to be. So you just have to be prepared to know your insurance is not going to cover that. And if you haven't met your deductible, you'll be paying a little bit out of pocket towards the hysterectomy, which is covered by insurance. But again, as most of us know, if you have a high deductible health plan, then you have to spend $1,000, $2,000, $3,000 out of your own pocket before the insurance even kicks in. So you got to pay for that part up front. You hit your deductible, then your insurance will pay for the rest of the hysterectomy. But the tummy tuck, out of pocket. So with this particular patient yesterday, she paid me up front for my surgeon's fee, and now she'll get a bill from the hospital for the OR time and the anesthesia time. And she may even get some additional erroneous surprise bills that she's not even aware of. And I try to prepare the patients for this, and just like I'm trying to prepare you for this, is that it's not always cut and dry. As much as you want it to be, it's not always cut and dry as we think it should be. So keep that in mind from the financial aspect of when you're getting a tummy tuck with a hysterectomy, but it is a very reasonable operation to get done. If you're the right candidate for it, then that's great. Just know that it's maybe not as straightforward as getting a tummy tuck done in a doctor's accredited operating room in their office. So hopefully that was helpful. A lot of information, but mostly just want to prepare you. So thanks for listening, and let us know if you have any other topics you want us to talk about. Just comment below.